exam, correct? Alright, let's get to it. Now, the first thing I'm going to do is ask you a few questions, okay? Okay. So the first question is your name. Alright. Date of birth. Alright. Your insurance. Oh, how funny is that? I have the same one. Do you have any past problem with your eyes? No? Awesome. I love hearing that. Any allergies? No? Alright, or none that you know of, right? this letter right here. What about this one? Okay. This line right here. Okay. What about this line? You can't even see it. Alright, not a problem. Let's take the machinery off and go ahead and read with both eyes this time. First line. Good job, good job. Second line. Good job, good job. Third line. Fourth. Fifth line. Next line. Interesting, you see how you know this letter now? Let's move on to the next line. Good job, good job. Okay, this letter. You don't know that one? Skip it. Okay. Alright. Okay, good job, good job. It's not bad, but it's not the best, but it's okay. You know, over time, sometimes our sight does deteriorate. That's perfectly normal. Now, the next test we're going to do is you're going to follow my finger, okay? Alright. Now, what this is going to help me do is see if any of your eyes stagger while you're following my finger, but this time it's not a bright light, okay? Alright. So go ahead and follow my finger. Alright, follow my finger. Okay, now I'm gonna go diagonal, okay? Good job, good job, good job. The other way. Good job. Now just focus on this eye, okay? Alright, go straight across, straight across. Alright. Next way. Good job. Diagonal. Next one. Good job, good job. Now let's focus with this eye. Did you notice with this eye you were able to do it perfectly fine? Yes, I noticed that too. Alright, let's go straight across. Follow my fingers. Good job. Next one. Good job. Diagonal. And diagonal. You really did well with that test. Now let's work on your peripheral vision. Go ahead and stare at the tip of my nose and tell me which finger I move, okay? Alright. Good job. Good job. Okay. I tricked you there, but you got it. I did move both of them. Drum. Good job. Alright. I got you again. Alright, good job. Alright. Good job. Now, while I was checking your eyes, I didn't notice anything unusual, so that is good. While you were following the light, I did notice that you had trouble with this eye right here, okay? So, let me make a note of that. While you were reading, you were able to do